Hello, this is tutorial number 11. I'm pleased now to show you how to change everything regarding audiometry and specifically the different frequencies which are used at the moment for airborne gap calculation and everything, which means also that you will need to open up the box to be able to enter pre and post-operatively of the frequencies. You remember, if you watch my previous tutorials, that I was at the moment using only 4 frequencies, 0.5, 1, 2 and 4 kilohertz, but I may be able to add more frequencies. There's like, for example, the 3 kilohertz, according to the American Academy guidelines, but also lower frequency, low pitch frequency, 125 and 250, for example. So that's important to be able to do it, and the program allows you to do it and to open up new box to enter those frequencies. So how to do it? You go to ONDB preferences like this, and then you open up this window from which you can change everything. If you look the first line, at the moment this line is related to the frequencies required for assessment. So it means the calculation of the airborne gap, air conduction, bomb conduction, mean air and bomb conduction, using those 4 frequencies only, which means 0.5, 1, 2 and 4 kilohertz. And but you can change that. For example, if you want to enter another 3 kilohertz, then you have to, not to enter, but you use the 3 kilohertz for calculation, then you need to click to this box. But of course, it means that you have previously allowed the software to enter those frequencies when you do the audiometry entry, which means 3 kilohertz in that case. So let's go back to those 4 frequencies at the moment. So I want to use the 3 kilohertz for calculation of those airborne gap, air conduction, hearing outcomes. And now, if you look to the second line, this is called mandatory frequency for audiometry. These are related to the frequency which are mandatory when you create a patient file with audiometry file, or when you follow up a patient post-operatively. So at the moment, again, we only have those 4 frequencies, 0.5, 1, 2 and 4 kilohertz. But of course, I want to be able to use the 3 kilohertz. And let's say I just want also to use, for example, the 250 kilohertz, or if you want, even the 125 kilohertz. So that's fine. So then you save this thing. And now if you go now to a pathology file and to create an audiometric file, compared to the previous tutorials, you will see that now we have the possibility to enter new frequencies. So let's try that. So let's say I'm going to enter a new patient, which I will call demo 3, and with the first name, so it was the same thing, of course, at that stage. So the first name will be ONDB again. Let's do the mandatory field only, so gender, male, and date of birth, like this, for example. So it means that we have a patient which is 39.8 years. So now let's create a pathology file. Let's do it shortly. So go to Otology, and then we want to create this, for example, cholesteatoma without cholesteatoma, so tympanoplasty. And let's say I'm going to create this primary surgery and left side. So of course we need to enter those information. You remember that the cross means multiple choice and the red dot means mandatory field. So let's just enter to make it short. The mandatory field, so otoscopy will be, for example, tympanic membrane perforation with tympanosclerosis. Let's say like this. Now we have to explain what is the type of perforation. Let's say that it's going to be a subtotal perforation. And also the etiology will be, of course, the chronic otitis without cholesteatoma. That's it. Now let's go to tab number 3, surgery. The surgeon will be myself, for example. But again, remember, if you want to add another surgeon, then you can click to other. Procedure will be, for example, andol, and with technique will be, for example, ossicular chain. I will describe those techniques then later with tab 4. Let's now describe associated pathology, and let's say that we have an eroded dislocated incus plus tympanosclerosis of the over window. So I need to find it, tympanosclerotic stapes fixation. That's it. So we have both pathology together. Mucosa was, let's say, inflammatory, for example. Now the grafting material, I did a graft because there was I did a grafting because there was a perforation. So I was using a perichondrium with underlay technique, for example. Now surgical technique. As you know, it's clear that if we have a simultaneous tympanic membrane perforation plus tympanosclerotic stapes fixation or whatever ankylosis of the stapes, I always, of course, stage the surgery, and I do the stapedotomy at least 1 year following the first stage, which will be tympanic membrane grafting only. But of course, this is a demo version, so let's say we do this in one stage, which is of course completely abnormal, but let's do it. And now we are talking about ossicular chain surgical technique. So I will do ossiculoplasty. That's it. I will define the ossiculoplasty later. Now the associated surgical technique. Let's say that I did a malleus relocation, so I need to find malleus relocation here. And now we need to describe the surgical technique for stapes. So I click on that and I will say, for example, stapedotomy, of course, with interposition, laser and drilling. And then the interposition was a vein graft, for example. And then the type of laser was luminis, for example, with Otology. All right, now it's fine. I can go to the last tab, which is ossiculoplasty. Austin cartouche group F. Austin cartouche group will be Austin cartouche group F. The type of prosthesis used was, for example, this one, a TORP, which could be Grace Alex-Lapidite Teflon TORP. But as you remember, at any time you can enter the name of a new prosthesis if you use another one. The position of the prosthesis is important, so I put it on from malleus to stapedotomy. So I need to find it here. Then I like to enter the prosthesis length, which is not mandatory, but I like that. So let's say it was, for example, 6 millimeter length TORP, and then the cartilage interposition. Let's say that I didn't use it. All right, so we have done that, and now I can save the pathology file. And now this is the demonstration. I will show you now to enter, of course, the audiometric file, and you will see that we will open up an audiometric file which will allow you to enter new frequencies as we determine in this area, ONDB preferences. So let's go. Click first to the line, then to the green arrow, and then that's the date of today, for example. And then it opens the audiometric file. So you see we have now 125, 250, 3 kilohertz, which are open, which means so you can enter them. So let's do it quick, like this. All right, that's it. That's it. Here and here. Now I can save it. Now let's say you want to see the patient later. So you click again to plus, and then you have the post-op. This will be the same data today, but again, this is a demo version, so it's fine. So I will validate and save it. And you see again, we have the same boxes that allow you to enter the frequencies. So let's say we do that, and of course the program now will be able to use all frequencies because you also determine that on this ONDB preferences, also the frequency which I use for a calculation of the hearing outcomes. So it will be using not all frequencies there, but you remember we select 0.5, 1, 2, and 3 and 4 kilohertz. So the program will use all those frequencies, but of course you can do whatever you want. And of course, because this is a post-operative audiometric test, you need to also enter clinical things that you find when you follow your patient. So you go to complication, and let's say, for example, we have, I don't know, maybe imbalance. We can put imbalance or any other. Ossiculoplasty was with an extrusion, pretty bad case, by the way, and tympanic membrane was with perforation. That's it. So now you have created another way to enter the patient with new frequencies, but it's clear that you need to determine exactly when you're going to change that, which means that if, for example, we have 10 patients before, for which you use only 4 frequencies, 0.5, 1, 2, and 4 kilohertz, then of course you need to select those patients out, because for the follow-up, this one, if you add the 3 kilohertz, that will create some problems. So you need to determine exactly when you start the new process of audiometric data. All right, so I think it's fine, so I can switch off this. The next step will be to demonstrate how to use in more details what I call the pop-up, which means how to develop the program to use it for other subspecialties of otolaryngology, which mean rhinology, head and neck, etc. And of course, as you will see, you will have to make the possibility not to use audiometry for those pathologies. That will be easy to do. And also, by the way, you can use this program for any other specialties like cardiology, pulmonology, etc. You can customize the program very easily, as you will see. To do this, we need to go to this control panel, but I will demonstrate that later, and that will be easy for you to do it. So thank you very much again for watching, and I'll be happy to reply to your questions if you have any question later. Bye-bye, take care.